So I'll give you two examples. Viz.ai. This is so cool. It's the first startup company or first company that has gotten this special reimbursement from Medicare. So what this does is it looks for LVO strokes, which is a very specific, very damaging type of stroke. And minutes count, literally seconds count when someone presents in the emergency room with an LVO stroke. And so Viz.ai is software that's used with the imaging, it's imaging analysis, and it is able to pick up LVO better than a human being. So it now, if you use this in the ER on the suspected stroke patient, you're reimbursed $1,040 now.
Wow.
So this is a technology that improves the patient's life, right? Could save their life and is being reimbursed at a pretty high level. You know, $1,000 to use the software is pretty good.
In the next 2 weeks of episodes, I interview Farmanfarmaian, a keynote public speaker and entrepreneur that has invested in several healthcare technology startup companies. Through her own personal health journey and work with cutting-edge technologies, she sees innovations coming to the medical office space that are and will change healthcare delivery and care. She is a professional coach and has written several books, the most recent on becoming a thought leader. Next week, we discuss how private practice physicians can use different marketing techniques to compete in the new healthcare economy. So, Robin, welcome to the Providers, Properties, and Performance podcast.
I am so excited to be here today. Thanks for having me.
Well, I'm excited for this interview. You know, I want to introduce you accurately to the audience because, I could say you're a health technology expert. I could say you're an entrepreneur. I could say you're a public speaker, but I know you encompass a lot more. So how do you define yourself?
I call myself a professional speaker and entrepreneur, but yes, I've built up a crazy different ecosystem where I can have multiple revenue streams from different skill sets of mine.
What started you on the path of exploring how technology can help clinicians provide more efficient or effective treatments for the patients?
Well, in my day job, I do high-level business development or help with product on early stage pharmaceutical, med device, and AI software programs. And all of these are really helping the patient. Now, the reason I chose to go into things like working on curing cancer or treating sleep apnea, which is a $10 billion industry, it's because of my background. So at the age of 16, I was misdiagnosed with an autoimmune disease. By the time I was 26, I'd had 43 hospitalizations, 6 major surgeries, and 3 organs removed for that misdiagnosis. And I was on high dose methadone. And I went to my doctors and I'm like, I don't think this drug is doing anything. I need to be off of this now. I think there's something else wrong. And they said, well, next step could be to surgically implant a morphine pump into your spine. I was like, are you kidding? I was 26 years old. I was essentially a shut-in. So I went home that night, fired my entire healthcare team, took myself off some of the methadone, which is pretty significant opioid withdrawal. I ended up getting diagnosed correctly when I rebuilt my team of physicians with Crohn's disease, was put on a medication called Remicade, and I went into remission within 24 hours. At that point, it had been a 13-year battle, and I had spent 2 or 3 years as a shut-in because I was just in such a significant pain.
Wow. So a personal journey.
And I made it my life's goal to impact 100 million patients worldwide because I believe in paying it back by paying it forward. I know I am alive today, not just because of that one doctor who ended up diagnosing me correctly and putting me on the right medication, but pharmaceutical, med device, software companies, EMRs, hospitals, clinics, doctors, nurses. I know they all had a part in my living through that 13 years. And so I can't pay them all back. So I believe in paying it back by paying it forward.
That's great. Well, can you share some examples of the technology-based healthcare delivery innovations that you speak about that are already in the marketplace or that you expect to expand or coming to the market in the near future, maybe, or something, that might be available, in several years further in the future?
So one of the things that is really helping lift up the shift in healthcare delivery shifting where the patient gets their care from the hospital or clinic into their own home is, of course, not just telemedicine, but telemedicine tools. I'm talking clinical grade remote diagnostic devices or clinical grade wearable technology. So of course, you're probably familiar that the iPhone is FDA cleared for their EKG single lead monitor, which can pick up, of course, AFib. But there are a lot of other devices besides just the Apple Watch. We now are looking at continuous glucose monitors that can monitor the glucose levels in interstitial body fluid 24 hours a day, 7 days a week in patients in their home environment. We see things like TytoCare, which is widely available in Best Buy. It's an Israeli company launched in Best Buy a couple of years ago now, about $300. And they have outfitted not only patients' homes, but lots of different places that have just a nurse on staff, maybe like a school or a sports arena. And what it is it's 4 clinical grade medical devices: otoscope, which looks in the ear, stethoscope, temperature monitor, and tongue depressor. And those clinical grade applicators attached to a video camera. So what you do is you call a physician through the app, and they're partnered with Amwell, which of course is one of the largest of the telemedicines. And the doctor walks you through using these 4 clinical grade devices on yourself or say on your child. And the doctor is the one who sees the video feed live. So she can say things like, okay, can you move the otoscope a little bit to the left, Robin, or move it a little bit to the right so that she has a better view.
Interesting. Well, you mentioned telemedicine, which is, since COVID, it was prior to COVID, it was sort of starting, and then COVID, it exploded. But pre-COVID, it was available, but not covered by insurance. And during COVID, it's exploded now. I think the main thing is to keep clinicians in contact with their patients. And now it is covered by insurance. So the clinicians get compensated for their time. So, I'm seeing all of this. And as a patient, I'll say, unless I need to see a physician for a physical exam, I would much rather prefer to have a telemedicine visit to discuss any just exam results or treatment recommendations or, more of a discussion rather than a physical, having to look at anything. We don't have to drive to the office. You don't have to wait in a waiting room. And I'm sure the physician can also schedule themselves for all their telemedicine follow-up calls in an afternoon and maybe become more efficient that way. But, they can have the patient's labs and information, on their computer while they're speaking to the patient. And, they can reach patients even in rural areas or that have long drive times and have more conversations and better direct their treatment course. I mean, do you agree?
Absolutely. And in fact, some of the biggest payers, so United Healthcare, it's a Fortune 5, company, and they are the largest of the privates. They have been reimbursing for telemedicine for a couple of years now. Not only that, but pre-COVID and during COVID, they send emails to their patients. So I happen to have United Healthcare, and I get a weekly or bi-monthly email saying, hey, Robin, how you feeling right now? You can click here to see one of our telemedicine partners on demand right now, and we're going to pay for it.
Wow.
And they have been doing that for a while because it is significantly faster, easier. And then you're making sure the chronic disease patients, because what you care about is really the chronic disease patients.
Right.
People who are healthy, who see a doctor once every year or two, that's a whole different story. But the chronic disease patients need constant interaction with their specialists, even when they're in remission, right? I still talk to my GI doctor 5 or 6 times a year through email most of the time, and I see him in office once a year. Now, moving those kinds of things to email or telemedicine video calls or regular audio calls is completely fine, because not only is there no reason in about 70% of the basic primary care doesn't actually need to be in person because there's no physical exam. Same thing with the specialist, right? There are many times I go in to see my GI doctor and he doesn't do any type of measurements on me at all, except for, of course, my vital signs. The nurse always automatically takes blood pressure, temperature, and weight when you walk into an office. But all of those things can be done now in a patient's home.
Right. And you can just tell them what the results are or show them.
Exactly.
And I don't know if you touch on behavioral health, but So, oh, you do? Okay. So, I see telehealth making a ton of strides in behavioral health as well, especially for counseling visits where more patients, they might be more willing to speak with a clinician if they're in their, home in a private, comfortable setting, and able to fit it into their schedule more, just with drive times. So I imagine this will help patients seek the help from clinicians that fit them better, via telemedicine rather than, having to, so they could find the right fit behavioral health clinician rather than say, well, I can't go to him or her because it will take me an hour to get there and an hour back. But now with telemedicine, um, don't you think, I mean, that's gonna now, I mean, you could even have somebody in a different state, you know.
Exactly. So if you're not dealing with a psychiatrist who's prescribing medication, there's really no reason to be in person in a therapist's office. And in fact, it has a lot more negatives than I think positives. Because things like, I went to therapy after I lost my mom to cancer about 12 years ago, it helped, but it was so incredibly stressful driving there, trying to park in the area, and then I'd walk in and I hated the smell of her office, like hated it so much. I'm like, I am miserable and stressed out getting to therapy. So any help she had on my, being able to deal with my mom's death was really negated by just the extreme stress I went through getting there and back, right? And so that's the kind of thing that is perfect for virtual therapy. And it doesn't even need to be video or audio. Companies like Talkspace, and they've helped me too. So I just happened to have a bad breakup, and it was maybe 4 years ago. And I was like, I don't have a therapist. I'm like, you know what? I was in the back of an Uber. I'm like, I'm just gonna sign up for Talkspace right now through the app. And I did. And it was seamless and it was so easy to do. And it was like 11 p.m. at night. And I started texting someone right away. Right. And then their therapists, at least back then, I haven't used them in 5 years, but at least back then they were checking their text messages twice a day. So they would respond, and sometimes you just catch them on there and you could have like a long conversation.
Oh, very nice. Very
Yep.
nice.
So
So,
it comes to you, like it's there when you need it, because you're never going to schedule a nervous breakdown at 2 p.m. on Thursday.
exactly. Life always happens on a slow Tuesday afternoon.
Yep.
Well, I see, they're obviously the new healthcare economy. There's a significant amount of consumerism because the consumer is now being burdened with a ton of costs. So, they're asking more questions and pricing actually, some services out. And, as practices realize this, and they say, I guess now we have to provide some customer service. We need to be more convenient and efficient for our patients. Do you see practices adopting a lot of this technology, um, where they have to in order to compete because patients are becoming more accustomed to them? Um, do you see practices um, starting to look in the future and to get some of these technologies on board?
Oh, of course. I mean, and we're talking a $3.8 trillion industry. You're going to have doctors that are back in 1950, and you're going to have doctors who are cutting edge, right? It's all over the board. But what I've been seeing, especially when I've been checking in with my doctor's appointments, is they are streamlining it. So doctors are now, or medical practices, because doctors are providing the product and service. They're not actually running the business. So the medical practices, they're starting to realize that a patient experience starts when the patient thinks about needing an appointment. It doesn't start when the doctor walks into the exam room. But we've been basing, everything on that 8-minute encounter. And so making it easier for patients when they get there, things like not having to stand in line or not having to interact with a receptionist, that the only thing she's allowed to do is schedule and take payment. She can't answer any questions of mine or medical questions whatsoever. So that is a really ridiculous interaction. Why are we forcing patients to go through that? So I remember when I checked in and I went to my dermatologist last month at PANTH, and it was so easy. It was amazing. While I was walking over there, I paid for my visit, my copay, on my app. I checked in, I uploaded my insurance card. And when I walked in, I just sat down in the waiting room and they called my name. It was
Absolutely.
awesome.
Well, I find it interesting that, if you go to a physician that you've been going to, but, maybe you haven't seen them in a year, you sit down and have to do like those 8-page paper documents and fill. I mean, I, I'm like, are you, when
Are you kidding?
nothing significant has changed. And, you're like, oh my gosh, like it's such a nightmare.
Yeah, that I have not seen that many people going electronic with that yet. And I'm hoping that they do and they realize that that is really a massive pain point for patients.
Right.
And and because they have to constantly refill out everything, it's not going to get done right. Right. There's going to be fudging. They're going to forget things. It's going to stress them out. So if they remember being stressed out at that appointment because they had to do so much paperwork, they're not going to come back.
Right.
And that's a problem.
Well, obviously all of these technology, it is an investment for a practice. And most likely, insurance isn't going to cover any investments in technology. Because insurance usually lags a little bit. So, if they're performing something, if they invest in a technology and you're using it, they may not get reimbursed right away, or may not, and reimbursements, as every physician says, they just continue to go down. But, given the out-of-pocket costs from the patients, that they have to pay because insurance covers less and reimburses physicians less, and then, the patient has to pay more, do you just see that, you know, there's going to be this convergence where doctors are going to have to invest first so that the patients will come and then get, and then have the payers kind of catch up just in order to capture patient base?
So it's depends on which product that you're talking about. So I can foresee, look at the big EMR companies, right? So Epic and Cerner and some of the other ones, they now have the ability to have apps on them, right? So it's more open, like not as open as say Apple's iOS, but it still has the availability to now integrate. And there are other companies like Apple who allow the patient portal side of the EMR to be downloaded and integrated into one on the Apple phone. So the technology exists now to do that, as well as the fact that Epic and Cerner have opened themselves up to that kind of thing. And so that makes it a lot easier, because that means you can just let the big, the big EMR companies and all the startups work on finding plugins and creating that easy patient experience, the front door essentially that's online,
Right.
and they manage it, right? And then it only costs you sometimes pennies or dollars per patient, right? So it's considerably cheaper to use a plugin type software a lot of the time. And we're talking over the next 2 or 3 years, that is going to explode, because a lot of these data laws have passed in the past, year or so. So we're going to see that kind of ecosystem explode the same way we saw the ecosystem around the Apple phone or the Android phone explode with apps.
Absolutely. No, I see that on the horizon for sure.
Yep.
So obviously, the goal, I think, for the patient is to reduce some healthcare costs, and then the goal for physicians would be to get paid, what they want to get paid for their service fairly. So do you see how these innovations can directly result in, lower costs for patients, and then, physicians being able to get, paid more for their services?
So I'll give you 2 examples. Viz.ai. This is so cool. It's the first startup company, or first company, that has gotten this special reimbursement from Medicare. So what this does is it looks for LVO strokes, which is a very specific, very damaging type of stroke. And minutes count, literally seconds count, when someone presents in the emergency room with an LVO stroke. And so Viz.ai is software that's used with the imaging, it's imaging analysis, and it is able to pick up LVO better than a human being. So it now, if you use this in the ER on the suspected stroke patient, you're reimbursed $1,040 now.
Wow.
So this is a technology that improves the patient's life, right? Could save their life, and is being reimbursed at a pretty high level. $1,000 to use the software is pretty good. Let me give you another example. Brain Check. So BrainCheck is clinical grade, FDA cleared neuro tests. They've taken the standard neurological testing that you have in a doctor's office that usually is done by a clinician. They've gamified it, electronified it, and turned it into a smart tablet app. And they're distributing, instead of through neurology clinics, which there's less than 14,000, I think, neurologists in the US. There's over 250,000 primary care doctors. So they're distributing through primary care. Now, the big thing with things like dementia, because that's what it's trying to catch, is that 30% of dementia is preventable. Preventable. But the problem is that there's so few neurologists, you actually have to go to a specialist, which, sometimes can take 1 to 4 months to get see the doctor. And most of us don't go to a specialist until we're so far advanced, and especially in something like dementia, that pharmaceutical intervention and behavior lifestyle modification is no longer going to make a difference in the patient's life. So BrainCheck is able to catch dementia at those early stages through primary care, and it just needs that app. So you check in at your primary care office, or you're doing a telemedicine visit, and they send you the app, or you take an app on a tablet that's at the primary care. You don't have the labor cost of the clinician anymore. Not only that, you're testing a lot more people, so potentially saving lots of money on treatment costs in advanced stage dementia. And in addition, they are reimbursed at, I want to say $432 last I looked, if you use the cognitive care platform and the cognitive testing.
Well, this is a little bit of an aside, but you would think too, once these technologies become adopted and they can get a huge sample size of information, this is where it's like, if a patient opts in and wants their information, to be shared for research purposes. But don't you think that, they're going to start getting a ton of data, and then once they process all of that, they might be able to actually help us, identify markers and things that we can do to avoid, certain health problems?
Absolutely. So think about blood pressure. Most of the clinical grade recorded blood pressure that's, in data silos or, in the big databases are taken on patients in the clinical environment. Now, there's we have two problems with that. First of all, you're not mostly measuring healthy people or baselines, right? You're measuring people most likely at their sickest. It's the chronic disease patients and the inpatients in the hospital that get their blood pressure taken 6 or 8 times a day. I get it taken 3 times over a 2-hour infusion every time I get Remicade, right? So most of the readings are people who are at their sickest or quite sick. So there's no baseline. But secondly, whenever you go into a clinic, there's something called white coat syndrome. It means that you're nervous, or you just ran in from the car and you ran up the stairs. You're outside of your normal environment, and that's where your blood pressure is being taken, which means it can actually be an incorrect reading. So you're never getting that perfect baseline. But with all of the new technologies, things like Omron's $500 blood pressure monitoring watch, right? It's the cuff method. There's BioBeat, which is a sensor that sticks right here, and then it picks up heart rate variability, and blood pressure through PPG technology, which is the same technology you find with the pulse oximeters that go on the end of the finger. It's just the first time someone has been able to extrapolate the data and get blood pressure through that reading. These are both clinical grade devices, right? And it's easy for the patient because they don't really have to do anything. They put on the device, or they stick the sensor to their chest and they put on the matching wearable, and they're done, right? They can get that clinical grade blood pressure in the home. This means we can now get it in the home on patients who are healthy and asleep. Do you realize we have none of that data? That doesn't exist, like a database of blood pressure readings on healthy patients while they're sleeping. But yet hypertension, it's 1 out of 3 people in the United States are hypertensive.
Wow. Yeah, no, I mean, I just think the possibilities of being able to measure people in a full 24-hour regular daily cycle life, and then have those data points, I think would be incredibly helpful for physicians.
Absolutely.
So, we're looking at all this technology coming on board. We're looking at, patients having, or practices having to be really customer service oriented. So for private practice physicians, they need to, which, they are entrepreneurs, but I'm not sure. Some of them have started creating brands, but some of them are going to need to in the new healthcare economy. So, you have a book called The Thought Leader Formula. So I want to move into that and see how we can relate that to the future of healthcare delivery. So, I think we've mentioned that healthcare consumerism is here. Patients are going to shop treatments and procedures moving forward, and they're going to try to reduce their out-of-pocket costs, which means physicians and practices will need to market themselves, as they will not always be able to rely on payer networks or insurance contracts to drive patients, because if the insurance isn't going to pay for it anyway, then the insurance doesn't matter. So can you share an example of where a patient should shop a treatment or procedure?
Mhm.
Start
Oh,
there.
so you want me to share?
So just like an example of like a procedure or a treatment that a patient could shop, for,
Yes.
if they're looking, if they're saying, hey, I need to find some practice that does this. And they go and try to Google it, and, and then whichever practice advertises it better is likely to get eyeballs.
Not only that, but there's that new rule, and I think it's federal too, but in California, where hospitals and clinics need to post their prices on their most common things, right? And so it turns out, so I mentioned I'm on Remicade, which is an IV infusion. I get 8 times a year. Now, I was getting it in a hospital and down the street, and I downloaded the prices, and they charge $28,000 per infusion just for the medication. I moved it into my home 6 years ago using a national company called Option Care, which actually covers about 90% of the alternate site infusion clinics. And this is a really big growth area, so listen to this story carefully. I moved it into the home, and it's just a full service pharmacy. They ship the medication to my home the week before. They deploy the nurse. She mixes it on site like a pharmacist, and then she administers the IV. They charge $1,200 for the medication. 28,000, and I have to go to a hospital where I'm surrounded by 14 other patients in a giant, extremely loud, noisy room with blasting televisions, and sit there for 5 hours and pay $28,000 for medication. Or I can be at home chilling out in my bedroom watching TV, have a primary care nurse, essentially one-on-one treatment for 5 hours, and I don't ever get exposed to any type of infectious disease, because of course, whenever you go anywhere that people are sick, you're being exposed to infectious disease.
Right.
Now, I'm small. This is a medication that is actually based on weight, and I'm about 90 pounds. So I'm getting a very small dose. My nurse has someone who gets a dose 4 times bigger than mine. Oh. Which means every time that he gets his Remicade, if he was getting it at that hospital, they would be charging close to $100,000 8 times a year.
This is where people go bankrupt, and then they can't actually afford care.
Yep. But now, not only that, but I mean, this is a 25-year-old drug. Right? Like there's biosimilars out there. This is not like, and it's not, obviously it's not Janssen, J&J putting up the prices. They are actually reimbursing me my copay now. And if they are selling it to Option Care for such a low price that they only have to charge $1,200 to actually make enough money on me as a patient, then you know that the hospital, there are hospitals that are really just, charging $95,000 too much per infusion. And the thing is now patients are getting smarter to this, because hospitals and clinics do need to post all of these prices. Right. And so those of us with large copays, when I was getting it done in the hospital, my copay was $1,000 each time. I had to spend $8,000 a year. Now I spend $100. I spend $800 total for the entire year. And so patients like myself, when you are on a long-term, lifelong medication that's expensive, we look for ways to get it cheaper. Absolutely. And now we can. And so we're going to see this mass exodus of things like infusions into the patient's home, not just because patients are learning about it, because no one ever told us before, but because the insurers are also fighting it. The insurance companies are forcing things like Remicade out of hospitals. They're saying, if it's done in the hospital, we will not pay for it.
So, so let's talk about how these physicians, set themselves apart. And obviously, being a thought leader is the first, I
Yep.
think the first point, because they have a lot of information to share. So, how valuable is becoming a thought leader and building a brand for private practice physicians in the new healthcare economy?
Huge, because you are now, especially if you're in primary care, you are now up against Amazon, Google, Microsoft, One Medical, Forward. There are just, One Medical is just primary care. I'm one of their patients. I love that. I love them. I spend $200 or $150 a year to be able to talk to my doctor whenever I feel like it. And it's amazing. They went public. Like, this is not some small little startup. This is a startup that is taking over the
Mhm.
country. And when you see primary care leaving the hospitals and clinics, there goes the specialist referrals, because many hospitals, of course, they have lots of loss leaders, right, where they're just spending a huge amount of money, but then they have some departments that really bring in a lot of the money, and that is things like primary care, to refer as the lead generator to the high-end specialists. And so if primary care is shifted out of One Medical, now when I'm looking for a specialist, I'm going to ask my primary care at One Medical. I'm not going to
Right.
automatically go internally at the same hospital or a healthcare system, because my doctor is just primary care. And so all of a sudden, you need to get your profile out there. If I'm looking for either primary care or a specialist, and I hear about Dr. Smith, and he is the best at this particular specialty, not only will I want to go see him, absolutely, I would probably be willing to pay more to see
Mhm.
him, and I'm going to be loyal.
Right. Hmm.
And that's a big thing, because once, especially with chronic disease patients, you fall in love with your specialists, right? If
Right.
they're amazing and you see that everyone else thinks they're amazing, and all of a sudden you don't want to switch, like, you have this personal investment in the relationship, versus like going to an ER where you see an ER doc for, one time ever, right?
Right. And even, if they have had difficult cases and if they have a relationship with the patient, to say, hey, can I tell your story? Because I think there's other people out there, maybe not exactly with this, but that are, especially with chronic disease. First of all, like you said, it takes forever to actually diagnose it correctly. You go through a battery of tests, and, um, that diagnosis, it can take years. And
Yep.
then once you have it, there's the ongoing treatment. And, for somebody to say, this person came in, with these sort of symptoms, and, we ran these tests and found this just to give the story of, a patient's journey that another patient can read on a website and say, oh, that's me. He or she might be able to actually help me.
Exactly. All of a sudden, for the first time ever, medical practices and doctors need to invest in advertising and marketing. And that's what that is. That is a
Yeah.
sales technique. That is, I will show you someone like you, and that will inspire you to hire us. That's just a basic sales technique. And all of a sudden, this is where healthcare has gone. And it is because these giant companies have gotten into it, who are consumer facing.
Right. And even, and I would say, people like, oncologists, that treat like these rare cancers. If you're trying to find a cure for your rare cancer, or trying to find somebody that can help you, with treatment, knowing that there's people out there that have had the same thing or something similar, and this physician helped them. I think that's incredibly valuable.
Hugely valuable. Now, my sister-in-law, unfortunately, she does have metastatic cancer, and so she had 13 brain tumors, brain mets. And so I found out who was supposedly the second best neuroradiologist on the planet, and got into him like right away, right? Because he had that reputation, because he has success stories, and he's doing it a little bit differently. That particular clinic was doing 3 weeks whole head radiation at once instead of 2 weeks partial, which is a standard of care. And so we went out of our way, and Kate traveled like 4 hours or 6 hours to get to that hospital to go see that one doctor
Yeah,
based on
absolutely.
reputation. Mhm.
Absolutely. Well, and then you talk a lot about multiple revenue streams in your book and how important it is. And so how can like, for example, how can a surgeon, like the physicians are probably like, well, I am I'm a heart doctor. So how do I create different revenue streams as a heart doctor? Uh, so, if someone was reading your book that is a heart doctor, how would they start with some ideas for some multiple revenue streams that they could take advantage of?
So first off, they have their main revenue, which comes in through them working on patients, right? Whether that is reimbursed or private or whatever that is, salary.
Right.
And then they have such an amazing, essentially, thing to teach people, right? So anytime that you can teach people how to improve their lives, how to make more money, how to be more successful in their love life, essentially, or how to make their kids better, right? Like essentially those four things, people will pay for that,
Right.
right? People will pay for those things. And so you have a huge wealth of knowledge. You can, of course, write a book. A book, though, to me is a tool to be able to, it's a marketing tool to be able to drive your revenue streams, because you don't typically make money on books. Even the highest end authors that have had like multiple New York Times bestsellers still spend $500,000 on marketing. So they're not making a lot of money, but
Yeah.
necessarily,
But it
right?
gives somebody like something that they can touch, or, they can say, oh,
Yes.
I'll read that on a plane or on my phone while I'm waiting.
But what that is a lead generator, because that puts those people into your funnel where you do something what's called upsells, right? So once you have a basic relationship with a group of people, whether that's because they've opted in on your website or for like say a free download or something like that, and they paid with their email address, or they bought your book, all of a sudden they're in your sales funnel and they've already bought into what you are selling. So you can do things like keynotes. I charge $10,000 to $20,000 a keynote when I go and give keynotes at large corporations or large conferences. Like I went and spoke at like the ANA or the AAD, which is dermatologists, or MGMA, which is the Medical Group Management Association. And so those are quite lucrative, and a physician can make even more money. There are, forget what they're called, the blue laws or red, it's a color, but if you're working with a pharma, there's something very specific. So there just has to be some disclosures if you're an actual physician. But then there are also things like online courses. I have a bunch of physician friends who have online courses that are teaching people how to do something specific. And you can charge $50 to $5,000 for those. You can upsell for consulting, right? Like I consult all the time. I charge like $500 an hour to do coaching, and people only usually need me for 1 to 3 sessions. So it's actually a small amount of money for them, but it's a lucrative revenue stream for myself, and I'm helping people, right? So
Right.
there are just so many different products you can do when you are a thought leader. But it's the consulting one. There are companies who have hired me for 6 figures to build personal brands.
Wow.
Right.
Well, I'm
So
thinking as a heart surgeon, or even a cardiologist, well, because I'm sure they could partner with a cardiology group if they're just doing the surgery, but say, hey, we could come up, like companies may pay us to come up with a cookbook and a grocery list and a menu to help, those that are having heart problems, or,
yep.
a post care diet and exercise regimen with videos, and they can partner with nutritionists, or even physical therapists, and they can post videos and cooking show. I mean, I think that, if they don't even have to do it all themselves, but they could build their brand and then bring people in and build an even bigger brand.
Exactly. And then the sky's the limit. I mean, what you just said, even, putting together a program or a cookbook, that's also a fantastic vertical for corporations. Corporations, their HR departments and their wellness programs will pay big bucks for things like that will make their employees healthier and reduce the healthcare costs. Like Walmart is self-insured, and they've got about 1 million employees under their insurance policy. And they're always looking for ways to make their employees healthier and to reduce their healthcare spending, right? And so being able to teach patients something about the heart or something about improving their health or hypertension or any of that kind of stuff is something that corporations might pay for too. And when you're dealing with the private corporations, that is the kind of big money, right? That is those are the ones that pay the $10, $20, $30,000 speaker fees or workshop fees,
right?
Versus, the public facing conferences or the academic conferences, they don't pay. So just make sure that you understand what does pay. Academic conferences, you actually have to pay yourself to get into the conference and pay for your own flights. Yeah. And then you don't get an honorarium. But that's just how academic conferences work. So make sure you are knocking on the right doors to sell the product that they will buy.
Yeah. No, I think that if they thought about it, that I think they really could start expanding their universe, with the end goal of getting of having lead generation for patients, but they're an expert. And I think patients might feel like the example that I was, staying with the same example of a heart surgeon. If you have a heart surgeon that, has like a post-operative plan for you, you're like, okay, so they're not just going to cut me open and then, and see me for a few follow-ups and, they actually have prescribed me a regimen that I can follow. And so they care about me, after they see me as well.
Yep. And that helps with lead generating for their main revenue stream, because all of us have one main revenue stream and theirs is probably doing, seeing patients.
Right.
Let me tell you about a friend of mine who's an anesthesiologist. And, anesthesiologists are one of the top paid specialties. Mm-hmm. And so he works full-time doing that, but he also does online courses. And he started in medical school, potential medical school students, teaching them what they need to do when they're undergrad and how to take the MCATs, how to study for it, how to get into medical school, how to survive medical school. And so he makes more money on his side project than as an anesthesiologist, and he's making a lot of money as an anesthesiologist, right? And so he has a lot of different revenue streams, because once he has a product, he's teaching college students how to get into medical school and how to survive that part of their life. All of a sudden, he has a product that he can package in a million different ways. Because let me tell you, in today's economy, people don't pay for content; they pay for packaging.
Yeah, right? Organizing it for them so they don't have to go and research a billion different areas and go down rabbit holes and lose time.
Exactly. Putting together that program and bundling it into a video program or a book or a series of articles, whatever that is, it's all about the packaging. That content can stay exactly the same. And that's one of Gary Vee's big secrets. So if you haven't heard of him, of course, he's a big social media phenomenon on like Insta and all of that kind of stuff, like a millennial generation. Is what you do is you write one thing, and then you just constantly take that same content and repackage it in different ways.
Right.
And so, like, I have 3 different books. My first book, The Patient as CEO, is all the ones, the AI, robotics, sensors, all the technology that's disrupting medicine right now. And I was able to repackage that into $20,000 keynotes. I had lots of different articles. I think 15 or 20 different articles came out of that. And all you literally do is you pull the articles out of the book.
Right.
That, and then you like a page out of the book and you publish that. And it's all about taking that one, content portfolio and just repackaging it in different ways.
Right. Well, because, people don't have a lot of time. So they're like, oh yeah, I'll flip through your book and, but then, and some people like to also hear you express your concepts verbally, and then, and then some people are like, just give me these snippets, one at a time, like in 2-minute blurbs, so that I don't have to commit, I don't want to commit to like a 30-minute video. So
and that
capture everyone.
And that's a really good point. It's in my book, I take you through the actual system, but I take you through really outlining your customer avatars. And if there's a lot of doctors who are listening to this, you guys have so much education, but you might not have heard of something like customer avatars, because that is purely a marketing thing, right? Mm-hmm. And you probably didn't get a communications degree. And so what that is really understanding who your audience is, who's mm-hmm. going to pay you, right? And so a customer avatar could be someone who is over the age of 40, married with 2 kids, living in one of the coasts or middle America, making $100,000 to $200,000 a year, with one chronic disease patient. Like, the more you know about your customer avatars and the kind of person who's going to pay you for your service, the better. And then once you've figured out, like, the best customer, then you figure out what kind of content do those people consume.
Right.
Right. I mean, if you're dealing with Generation Z, you got to be on something like TikTok. But if you're dealing with, like, I'm a Gen X, like, I'm on LinkedIn and I like to read articles. I just don't even understand 15-second videos. I'm like, why would I watch that? Right. And so really understanding what type of content and form factor do the people who would actually pay you money for want. Right.
No, I think that is great advice. That's great advice. Well, Robin, I want to move into the Q&A to get to know you a little bit. I could continue talking to you for several hours. I find this fascinating. Okay, so what was your first job?
Oh, I was a babysitter nanny at like the age of 12. Yeah, my mom was a pediatrician. And so, like, people always wanted to hire me because they knew my mom was a phone call away down the street and she was a doctor.
That's great. Yeah, no, absolutely.
I got lots of clients when I was 12.
Absolutely. My mom's a phone call away if your child is in any harm.
Exactly.
What would you be doing for a living if you were not doing what you're doing now?
Probably be the CEO of a multinational corporation.
Wow.
Yeah, that was like, I'm very intense, but I went a completely different direction. I went into the early stage startup world because, it's pretty high risk and it's the cutting edge, but it's more around my personality. But when I was in school and a teenager, I always just assumed I was going to be the CEO. And most likely it was going to be a corporation in medicine or preventive medicine.
Wow, I like that. Who are you reading or listening to right now for news, information, or inspiration?
Oh, I am rereading Eric Topol's book right now on artificial intelligence because I've been really writing out this big series on AI, and I've got most of it written, but I love to reread his stuff because he's a physician, and he just has a whole different viewpoint than I do. So I love seeing it from his point of view.
That's interesting. Does he is he excited about AI?
Oh yeah,
getting more into medicine.
Yes, and most of my stuff, like, I just do very high level, so you understand that the technology is coming. He cites all the studies. He talks about, it's definitely higher level reading. Like my books, you can read no matter who you are. You do have to be in healthcare to understand a lot of it. It's more technical, but that's why I also love it because I get to see all the little details and stuff like that.
Yeah, I just finished the book Why We Sleep, and they go into a lot of the technical studies and stuff like that. But I found it incredibly fascinating.
Exactly.
But it's the same thing. Like if you're looking for an easy read, that's not it.
Yeah, you see, know your audience and what type of content they want to consume.
Exactly. So, what is one thing you do every day for healthy self-care?
Oh, my morning is always fixed. I work out an hour a day to an hour and a half sometimes, and 7 days a week, 365 days a year. And it does not matter how sick I am because, I'm a chronic disease patient. So with Crohn's disease, even under control, there are still, bad nights, bad pain nights. I don't have a large intestine. So like I have a J pouch to deal with. And sometimes I wake up and I'm drenched in sweat from pain and I can barely stand up, and it doesn't matter. I am on my Stairmaster and then my elliptical for 60 minutes, period, end of story. I get there. And my doctors think that's one of the main reasons I am doing so well. Like on a normal non-pandemic year, I travel the world. Yeah. And I give keynotes on lots of stages, and I work 2 or 3 other jobs with startups, and I do coaching, and I'm incredibly busy and very active. And that's not normal for someone who was as sick as I am. And so really it's the exercise. I'm also about 10 to 12 years older than you probably think I am by looking at me.
I'll never ask age. I don't do that.
29. We're always 29.
Yeah, exactly. I love the 9 birthdays. They're awesome.
Yep.
Are leaders born or trained?
Oh, both. It depends. That's too general. So some people are just born leaders and they get up and they just naturally know how to do it. And then some people are leadership is thrust upon them in a situation and they really rise to the occasion, although they've never thought of themselves to do that before. And then some people look and say, I want to be a leader, and they can follow a path to build themselves into that. So it depends on a lot of your personality traits.
Yeah, absolutely. No, I like that. I like that. Well, Robin, this has been a fantastic conversation. So if someone wants to reach out to you, if like, what would be a target person for you, in the healthcare space?
So I do a lot of keynotes. So if you want to learn about essentially one of my biggest ones that people hire me for, and I'm doing a keynote for the ICD coding academy, which is, so there's going to be about 1,600 ICD coders. I was like, oh, that's kind of cool. I never get to talk to people like that. So that's going to be kind of cool. But what I'll do is I'll spend 60 minutes on the shift in healthcare delivery. So AI voice bots, so vocal biomarkers, things through Amazon Alexa, the TytoCare, like I mentioned, the point of care diagnostics. I'll talk about some of the EMR integrations. And I usually try and outline, depending on who it is, like if United Healthcare comes in and tells me that it's for their top employers, then I will show them how I saved $1 million on my top line billing by switching, Remicade into the home, and how they can do that for their patients or their employees. So it's very personalized, but really it's going to be that full overview of AI, sensors, communication devices, and what's being reimbursed and where it is. So I talk a little bit about CMS because, of course, CMS sets the standard of care.
Right.
And so I say, what are their cutting edge things that they're reimbursing for now that you can take advantage of?
Well, and I think you get a lot of credibility saying, hey, I have navigated this system, and through trial and error, I'm an example myself of how, I've done this myself, so that I can live a normal life.
Yes, exactly. Well, that's what gives me a lot of the credibility. And then in my day job, of course, I do work on things like early stage pharma, trying to cure cancer. I've invested in inhaled insulin. I've invested in a vaccine. So, I mean, like, I am in the thick of some of the most cutting edge of the technologies to begin with is my day job. There's one company I'm working with that's a virtual reality for stroke and brain injury rehabilitation with FDA clearance.
Wow.
I know.
That's awesome.
Yeah.
That is awesome. Oh, that's great. Wow. Well, it's so exciting, Robin. I'm so glad we were able to have this conversation, and I look forward to having another one at some point.
Absolutely. Thank you so much for having me.
Thank you.